Hello, my friends. My name is Dr. Sayed Kazmi. You're watching my YouTube channel, and in today's video, I'm going to talk about some of the main parameters of quality assurance. It's going to be a simplified lecture where I will be talking about what are the main domains that you have to focus on when you are talking about quality assurance in healthcare services, especially in context of developing countries. Those who haven't watched my very first video on this topic, in which I defined quality, I defined the differences between quality control and quality assurance, they should stop here. They should go back, view that lecture, and then come back and start from here. Here in UK, we have got CQC. It stands for Care Quality Commission. It's an independent body that ensures that quality assurance is maintained among all levels of healthcare services. It does accreditation, it does inspection, and it set the standards for all levels of healthcare services here in the United Kingdom. Back in developing countries like in Pakistan, people think that quality assurance is something which is related to getting ISO accreditation, getting JCI accreditation. I think all those things are very complicated. If you focus on the parameters which are set by CQC in UK, that makes it very simplified. And in today's lecture, we will be focusing on those 5 domains, what the CQC looks at and how it can be incorporated in in context of developing countries like Pakistan. So let's start. Now, the very first thing is those 5 parameters, those 5 things that the CQC looks at, and these forms the core domains of quality assurance among all levels of healthcare services. So, in very simple words, if you are making a quality assurance setup within your hospital, you have to make sure that whatever domains, clinical domains you are looking at, it has to focus on 5 things. And those 5 things are that your clinical services across the board should be number one, it should be safe. Number two, it should be effective. Number three, it should be caring. Number four, it should be responsive. And number five, it should be well led. These are the 5 basic pillars of quality assurance, which the CQC recommends. And I think this is the same thing that can be replicated in developing countries like Pakistan as well. So we will talk about these 5 domains of quality assurance one by one. So we'll start with what is safety, how it is measured. Then we'll be talking about how the services can be effective, then how they can be caring, how they can be responsive, and how they can be having well led or having good leadership. So let's start with the first domain, and that is what is safety in healthcare services. Now, the first domain, that is safety. Safety means that we have to ensure that our clients, the people, they are both protected from abuse and from avoidable harm wherever possible, and that there is an open and just culture within the healthcare services, within the trust, within the hospitals, which promotes a continuous learning process. So the key levels of inquiry within this domain of safety that you have to measure, you have to look under this domain that is being safe, is that how safe has the care been in the past? So what has been the in hospital, let's say, mortality? What has been the number of serious incidents within the hospital? What have been the rates of the near misses? What have been the falls within the hospital? So on and so forth. So you have to see how safe has been the care in the past, and that past could be 6 months, 1 year, depending on how you want to measure it. Number two, the safety also talks about how can the provider, the healthcare providers, I mean the hospital administration, they can demonstrate that they are consistently learning. And if in case if something goes wrong, for example, there is a serious incident, in case if there is a rising hospital mortality, so is there a inbuilt process of learning by which the clinicians or the administration, they can look into what has gone wrong and then learn the lessons, and then of course make those corrective measures if required. So is there is a mechanism of that sort or not? So this has to be seen under this domain. It also looks into how reliable are the system processes in practice. So all those system processes and practice that are related to safety, how reliable they are. Are they giving you the true information? Are you they depicting the true picture? Or no, they are just like sort of a proxy things which are not giving you the true picture. So again, it has to be seen within the same domain. Then it also looks at how safe is the care today. I mean, you look at the care in the past, like what has been your incidence rates regarding different serious incidents, mortality in the past, and you also look at the as of today, like let's say you can do it for the last 1 week, for last 1 month, to see how things are, and then you can compare it with your past values to see where do you stand with respect to your past. And it also looks at how confident you are that the care will be safe. So again, whether you have got processes, whether you have got budgeting, whether you have got the resources that makes your care more safe. So is there any mechanism of that? So all these questions are answered under the domain of your healthcare services being safe. So in a quality assurance, you have to see whether your services are safe or not. So you have to look into all these domains. Now, what does that mean in your daily clinical practice? Because the next question would be fine. I mean, okay, fine. We talk about safety, that how safe were the services in the past, how safe are the services today, what are the processes, whether they are reliable, blah, blah, blah. So, what does that mean? How would I know what it means with respect to my day to day? Usually, doctors can ask you this question. What does it mean for me? So, for that, the practical applications of that, what it means in the daily practice is, number one, have you got the complaint posters? Like, for example, if somebody has got a complaint, so do they know where they have to put up their complaints? What is the process of, like, putting up a complaint? Is there a process of learning from incidents? Like, is there a mechanism of reporting these incidents? Is there a mechanism by which meetings are taking place, morbidity and mortality meetings? Or there are mechanisms like, do you have got audits, clinical audits that you do every now and then to see how your practices are as compared to the set standards? You can look at the identity badges, bands in place. Like, for example, your patients who are lying in the hospital, have they got the ID bands in place, like which are wrapped around their hands or feet? What about infection control? Is there like infection control procedures being followed? Is there like hand gel, washing basins, things like that? Are they being practiced? It also means your sluice, whether it's clean and tidy. It's not like dirty where all that like stuff is lying around like in the dirty utility. It also means your call bells are near the patient, so in case if they've got an emergency or something, they can just press the bell button and can get help. It also means that your wards are clutter-free, they are clean, uh, your linen is handled in a very appropriate manner in which there is no chance of cross-contamination. There is a safe surgery checklist that is being, and obviously patient service as well, like taking some exits service from the patient to see how happy they are as far as the safety of the services are concerned. So this is what it means when we talk about the domain of services being safe. So safety is one of the first domains of quality assurance. Moving on to the second one, and that is whether your services are effective or not. So after safety, effective. Effective means like, if you plan something, it is supposed to achieve that end objective that you have planned. So by effective, it means that the care and the treatment provided in the hospital is all evidence-based, and it achieves good outcomes in terms of like more morbidity decreased or mortality decreased, and whether it leads to any decrease in premature deaths, it leads to a good quality of care, a good quality of life for your patients, and or for those people who have got like long-term injuries or long-term debilitating conditions like diabetes, stroke, etc., whether your services can get a good outcome for them or not. So this is whether your services are effective or not. So how do you know, like, what are the key levels of inquiry? Like, if you want to measure whether your services are being effective, so you would see whether your care and treatment which is being delivered, is it in line with the current legislation, like whatever the laws or the legislation says about how should be the healthcare services, whether it's meeting those standards, whether you've got the national for following the national standards or international standards or whatever, like whether they are being met or not. Okay, so whether it's translating into good outcomes for them or not. So this is one level of like inquiry. It also looks into how your provider supports and facilitates the multidisciplinary working. So obviously in a hospital, like you've got different departments, you've got like different specialities, so how good they are with one another, whether they are working in tandem with one another and trying to achieve outcomes, or whether they are working in their own directions and there is no sort of a coherence between them, there is no coordination between them. Obviously that would lead to delayed care and obviously bad outcomes, so you have to look into these processes as well. Then it also looks at how your provider works with other health and social care providers. So whether you've got no good networking within the community, whether you are working with the partners, or you're just working in isolation. You are the hospital and you damn care like how once the patients are discharged, how they go into their community, what is their follow-up process, where would be the follow-up, and so on and so forth. It also looks at how the provider that ensures that the staffing arrangements, they are adequate and they do not deliver, they do not like compromise on quality. So obviously you have to see whether you are well staffed, whether you are well resourced, whether you've got like appropriate mix of skills at all the times, which ensures that your services are being effective. Not like for example, in the daytime you've got all the consultants and specialized services available, but out of hours we have got nothing, so people are just like running from pillar to post, and obviously your services are not affecting out of effective out of hours. So you have to like look into these things. And it also looks like how your healthcare provider, like the administration, how it is it monitoring and improving the quality of its care and treatment. So is there any mechanism by which like they are everything is there on the radar screen, they are monitoring that and making any corrective efforts. Like here is where the quality control things come into action. You got a QC process within the QA system that looks at all these things. So this is all about the domain of being effective. What it means for your daily practice, it means whether you have got like safe storage of patient records, you've got clear documentation, everything is legible, the plans are there in place, there are accurate records. It's not like thing records are missing or something has been done but it's not been documented. It's about assessing pain all the time, seeing the patients are pain free, incident reporting. It's about like keeping the charts up to date, locking the trolley so that there is no pilferage or unauthorized use of emergency medicines. Again, it's all about like who is who in the trust or at the hospital, like how are the duties or the responsibilities, they they are divided. How is the confidentiality maintained? It is very important. I mean, in developing countries we've seen that the confidentiality is not maintained even when the cases are being presented. Every original sort of documentation or identity is used, which is not the right thing to do. Confidentiality is very important, and obviously a lot of emphasis is placed on the confidentiality in the West, but I've seen in the developing countries people don't pay much attention, but it should be done. It's one of the domains of quality, and keeping everybody informed about what you're doing about the care of the patients. So this was the second domain. Moving on to the third domain, that is your services should be caring. Caring means that people are treated with compassion, they are treated with kindness, they are treated with respect, they are treated with dignity. So again, the levels of inquiry within this domain of being caring is like how are the patients or their relatives, or those who are close to them, they are involved in the decision making, whether they are kept informed about the treatment and the condition. It also looks into how the staff, they communicate and develop like sort of a working relationship with the patients and their carers or their relatives to keep them on board. It also looks into how they need to cope emotionally. So obviously hospital is a very emotional place, so things can go up and down in there. So in case if somebody needs emotional support, so have they got like some form of inbuilt mechanisms to offer support, emotional support to those people who might be undergoing life changing things. Similarly, are the patients made to feel safe and comfortable with dignity while they're receiving hospice? So whether they've got like privacy, they are not being treated in the open, they've got curtains, they've got cubicles, they've got, in case if you're doing something which is considered to be an intrusive process, whether they've got like availability of chaperone and things like that. So this is all about whether your services are caring or not. What does it mean for the daily practice? It means that you have got privacy and you maintain the dignity of the patients. You keep a very good professional tone. You've got a good attitude and behavior. You listen. There is no noise at night time. You support them at meal time. Obviously, for old people, they're not able to eat on themselves, so you give them some form of support. If they are vulnerable something, they got wheelchair, another form of accessibility so they can move around. If you've got dementia patients, so they've got support so that they are not feeling lost in the hospital and feeling threatened. Similarly, if those people who are at the end of their life, so you give them all the measures that make them comfortable so that they can die in peace. and obviously people who have got like language problems and things, you've got interpreters or those people who can do the sign language sort of translation for you, so on and so forth. Then the fourth domain is being responsive. So responsive, it means that people, they receive the treatment and the care that they need. It is according to their needs, so that means it is responsive and they get it at the right time. It's not like people are waiting and waiting and waiting and they're not getting the treatment that they need. So it needs to be responsive. And again, what key levels of inquiry? Again, the local sort of plans that you've got or the services that you're providing, that should be in line with the needs of the local population. So if let's say a problem is prevalent in a society, you should be having services related to them, not of something which is not a problem and you have got like services uh, for those things which are like which is less prevalent in in that particular geographical area. Again, it also looks into how the staff, they look into the patient needs at various stages of their treatment, like people who have got vulnerabilities, how they are looked after, whether they are able to communicate their needs and whether they are being taken care of or not. And then again, those people who want to leave the hospital, whether they are being listened to, whether they are they get the right information, what is good for them and what is bad for them, so on and so forth. So these are all the things that would be looked into under the domain of the services being responsive. What it means for the daily practice, it means that, for example, in case if the patient has got call bell around the bed, whether it's answered in a timely way, it's not like after 2 or 3 hours somebody attends to them. There's discharge, proper discharge planning. So, okay, fine, you know when the patient has to be discharged, what would be the criteria for discharge? There's a clinical leadership. Everybody works in a team. There again, those people who have got mental capacity issues and other things. So there is some decision as to who makes decision for them. Again, like it is about proper handover from shift to shift. So all the information from one team is passed on to the other team. So at least there is no like sort of delays in making appropriate clinical decisions. Again, it's about staff safety forum. So you discuss everything that is related to safety. It's got like quality rounds where quality things are debated, ward information. And again, it's also about not taking your problems in the hospital home. So everything that is within the hospital should be left within the hospital, and you should be sort of, in other words, private life should be separate from the professional lives. Last but not the least domain is being well liked. That you should be having a good leadership. So it means that, remember, leadership and governance is very important for any organization. And again, because and it helps in an organization to hold itself accountable for its decision, for its working, and it also looks into the performance and actions of that organization, and it helps to make any corrective actions if things are going wrong. So that are the domains of a well-led organization, an organization which has got good leadership, which looks into all these things and makes the appropriate decision at the right time. So the key levels of inquiry here are: is the governance framework coherent? So you've got like well placed like hierarchy of who's who, what are the what responsibilities, what are the delegations of power, so on and so forth. Um, how are the staff concerns dealt with? Like, for example, if staff are not happy about something, so what is the processes of getting the things up in the leadership hierarchy, whether it listens and how it responds to those things? How does the provider it make sure that the leadership is within the organization is safe and is effective and it's well maintained? So is like if the board of directors or governors, whosoever is there, what are their mechanisms of looking into that different departments are led by appropriate leadership? And then it also looks at whether there are appropriate levels of staff engagement so that everybody is kept on board regarding different decisions. So in planning we always say is that those who are the low level sort of people who are responsible for execution, they should also be involved in planning. So what sort of planning procedures are there, whether everybody is listened to, whether their voice is heard and is incorporated into the decision making or not? So all those processes, they are looked in within the domain of whether your services are well led, whether you've got good leadership or not. What it means for the daily practice. So, for example, for nurses, it would mean who's your matron, when to approach them, who's your head of nursing or the divisional nursing group head, whether your ward is tidy or not, what are the patients saying about that, what is the assistance that we can, on whiteboards, whether whiteboards are available above the bed where you can write the things, and whether they, so all these types of things, they are actually part of knowing that whether and your services are, or whether your organization is well led or not. So to summarize it once again, quality assurance is all about 5 domains. So these domains, as I told you, these services have to be safe, effective, caring, responsive, and well led. And I told you what that means for your daily practice. So this is a very simplified version of the domains of quality assurance that should be looked into. So when you are planning your quality assurance department within the hospital, when you are trying to uh, trying to make this department from scratch, so you have to look into these 5 domains, and you have to further work up within these 5 domains to make your parameters, like your key levels of inquiry. And that's how you would be having a proper setup of quality assurance, which can then later on be measured and corrected by your quality control department, which will be within this umbrella framework. So thank you for listening this lecture. It's a bit complicated, but if you haven't understood anything, just like put your question down in the comment section below. I'll be more than happy to answer them. So if you haven't subscribed to my channel, please do subscribe. And if you have liked this video, please press the like button and press the bell notification icon, so whenever I upload a new video, you're always on board with me. Have a good day, and bye bye.